Flu, COVID, and RSV remain high across the US, and they're likely going to stay that way for several more weeks. The CDC also reports that this is causing a lot of people to seek healthcare at a high level. So many hospitals and physicians are likely really feeling this right now.
Hello and welcome to the AMA Update video and podcast. Today we have our weekly look at the headlines with the AMA's Vice President of Science, Medicine, and Public Health, Andrea Garcia. I'm Todd Unger, AMA's Chief Experience Officer. Welcome back, Andrea.
Thanks, Todd. It's great to be here.
Pretty chilly day here in Chicago and lots to talk about as usual. Andrea, last time we talked, we didn't get a chance to talk about bird flu, but there have been some developments, including a new CDC alert. Tell us more about that.
Well, Todd, last Thursday, the CDC issued a HAN, or a health alert, to clinicians and laboratories in response to those human infections we've been seeing with avian influenza A, H5N1. And the agency is urging healthcare professionals to accelerate subtyping of all influenza A specimens from hospitalized patients, particularly those who are in the ICU. The agency is recommending a subtyping diagnostic test, ideally within 24 hours of admission, as well as increasing efforts at clinical labs to identify non-seasonal influenza. The alert also emphasizes to clinicians starting antiviral treatment such as Tamiflu immediately without waiting for those test results, and taking a thorough exposure history from a patient with suspected or confirmed influenza who is hospitalized. And as we talked about last week, this alert does come at a time when levels of seasonal flu activity are already very high.
Well, Andrea, what's the thinking behind this change?
Well, this approach can help prevent delays in identifying human infections with avian influenza A viruses. We know that those delays in diagnosing bird flu can complicate public health investigations, delay treatment for exposed individuals, and can also affect hospital infection control. Those patients who are not tested right away might struggle to remember where they've been exposed or the people they've been in contact with since becoming sick. Plus, with those seasonal cases so high right now, it's really essential to distinguish between seasonal flu and bird flu as quickly as possible.
Well, this theoretically seems like a pretty easy fix, testing people as they get, of course, admitted to the hospital. Is it that easy?
It may sound like it, but most influenza tests ordered in clinical settings don't distinguish between avian influenza AH5 and seasonal influenza A viruses. So a positive result simply confirms an influenza A virus infection. If hospitals don't have the capability to do that subtyping on site, they may need to send those specimens to either commercial labs or to public health labs that do. And then it's also going to be important to notify that health department promptly if H5N1 virus infection is suspected, probable, or confirmed in a hospitalized patient. A CDC spokesperson noted that by the time these test results often come back, the patient may already be discharged, their household contacts may no longer be within the window for effective antiviral treatment, which we know works best when it's given early.
So lots of challenges there. Andrea, given the circumstances, what are the numbers looking like right now for both seasonal flu and for bird flu?
Yeah, looking at seasonal flu first, the CDC is estimating that there have been at least 12 million illnesses, 160,000 hospitalizations, and 6,600 deaths from flu so far this season. As for bird flu, we recently learned about another human infection, a child in San Francisco who developed a fever and conjunctivitis, but was not hospitalized and thankfully has since recovered. Including that case, 67 people have been infected by bird flu to date, and California has been hit the hardest, accounting for 38 of those cases based on the CDC data.
Now, Andrea, I know a few months ago there had been some discussion about a vaccine. Any movement on that front?
Well, Ted, as we've discussed previously, there are several vaccines that target H5N1, and the federal government has been working to increase the number of doses in the national stockpile. Just last week, we did see the U.S. Department of Health and Human Services announce that it will be awarding $590 million to Moderna, and that is to accelerate the development of influenza vaccine, including those that protect against bird flu. We do know that since 2023, Moderna has been working to create pandemic influenza vaccine, which would help protect against certain viruses, including H5N1 bird flu. This new funding builds on the $176 million that HHS awarded Moderna last July. On Friday, Moderna said that this additional funding is going to help pay for late-stage development, licensure of the vaccines, and expanded clinical studies for additional subtypes of pandemic influenza to hopefully help prevent other potential public health emergencies. And as a reminder, last week we talked about how Moderna is currently enrolling participants in a stage 3 trial for a norovirus vaccine. There's definitely a lot going on in the space.
There is a lot, and that's good news. Andrea, we'll look forward to seeing what comes out of that research, obviously. Let's turn our attention to the myriad other viruses that are out there right now. What's the background there?
An ABC News article published earlier this week gave a good overview of the situation. And according to the article and CDC data, cases of flu, COVID, and RSV remain high across the US, and they're likely going to stay that way for several more weeks. The CDC also reports that this is causing a lot of people to seek healthcare at a high level. So many hospitals and physicians are likely really feeling this right now. As of January 11th, emergency room visits and hospitalizations were highest for flu, followed by COVID and RSV, which are at similar levels. Death rates, however, at the highest for COVID at 1.4%. Followed by flu at 1.2% and RSV at 0.1%. The CDC also said that while some indicators may be suggesting that illness activity has decreased or remained stable, this could definitely be due to reporting delays from the winter holiday and changes in whether people decided to seek healthcare rather than an indication that respiratory virus activity has actually peaked.
All right, well, thank you for that update. And I know the advice continues to remain the same. If you feel sick, stay home and be sure to contact your physician if symptoms persist. Of course, it's also never too late to get vaccinated.